While mass distribution of the COVID-19 vaccine has allowed the easing of lockdown restrictions, and life slowly returns to normal for the majority of the British public, it is estimated that at least 1 million Brits are currently experiencing long-lasting symptoms of coronavirus. This has come to be known as long COVID. New research has suggested that 1 in 5 people who have coronavirus will become long haulers, the term used to describe those suffering from long COVID. The main symptoms include fatigue, breathlessness, anxiety and depression, chest and muscle pains, heart palpitations, and brain fog. But doctors have found at least 20 different symptoms which long haulers could experience, with little understanding of how this is actually happening.
We don't know what long COVID is, we don't know what's being caused by, but they have a list of symptoms which people tend to seem to have, but we don't really know for sure what the common or most common symptoms people have are, what the likely kind of path of that is.
This current lack of knowledge has presented a whole new range of challenges for doctors in establishing how best to treat and support those living with this mysterious and debilitating illness. Sam Munslow is a mental health and leadership coach and mum of 4 who has been suffering from long COVID for over a year. Her extreme fatigue can leave her bedbound for weeks, but the main struggle she's faced has been mentally.
I think with long COVID, the guilt is a really big one, that we can't do the things we used to do. I can't be the mum I used to be. I can't go out for long walks. I can't go for bike rides. I can't stay awake all day sometimes. And sometimes I'm not interested when they're talking because I'm too tired to listen.
One time, Sam's 14-year-old son was telling her about a Lego crossbow he'd made, but she couldn't listen to him because she had to focus on breathing, and it left her feeling like she's a bad mother.
I held on to that guilt for months, and yeah, it's mental self-harming. It's the layer we add on to what's really happening. Fact and fiction. The fact is I can't breathe, the fiction is that I'm a bad mother as a result of it. In reality, what can we do to let go of that bit? Because although physically we have limitations, adding mental self-harming, mental barriers on top just makes it harder. Fighting it just doesn't work. Fighting it causes frustration. Fighting it causes loss and grief for who we were. So while I'm sitting here thinking, oh, I remember when I used to be able to do that and I used to be able to do that, then where I currently am is not good enough. Or I can't wait till I'm better, and almost putting everything on pause until I get better. If I'd done that, I wouldn't have written my book. I wouldn't have been on holiday with my family. I wouldn't have enjoyed all the things that I've enjoyed. I can still enjoy my life however it presents if I stop putting the mental barriers up. The mental barriers are the bit that hold me back. The physical thing does as well. There are times when I can't do things, but it's very much about accepting where I am to allow myself to enjoy my life however it presents.
Sam has written a book about her journey with long COVID, hoping it will help other long haulers see past the mental self-harming which comes with the physical limitations of a long-term illness. But she also wants to see this type of mental support being provided by the NHS.
The mental side of it is significant from the people that I speak to, that a lot of them feel dismissed, they're not taken seriously, and the physical illness is the thing that the doctors will focus on because that's what they know. My GP didn't seem to get long COVID, and I didn't blame him for that because how could he? I didn't get it and I was going through it. Nobody else understood it because we've never experienced this before. So he didn't dismiss me, but he went off what he knows and then referred me where he needed to. But the understanding wasn't there. I can't fault him for that because he can't know what he doesn't know. The physiotherapist has been great. The hospital have been fantastic. I have had support as much as they can support me, but they don't know how to. So they are limited in what they can do. What I've found more than anything, although medical issues do arise, and I recommend anyone that has a typically long COVID symptom flare up, I've got palpitations again, don't just say, oh, it's just long COVID, always get them checked out. But the bit that's missing that I found is the support mentally.
But this lack of mental support is not just because long COVID is a new illness with little understanding. Dr. David Martin, a psychiatry trainee with 4 years of experience working in mental health services, explained some of the issues which doctors are facing and the effect this may have on sufficient provision of mental support.
I remember feeling at the time as a junior doctor that I felt frustrated by how difficult it was as a doctor being busy on a ward, covering 40 patients, trying to see them all in one day, every day. You don't have the time to sit down with someone and talk at a more human level about how they're doing in COVID now in hospitals when they're busy. The workforce of hospital staff are exhausted. I have colleagues who have worked through the pandemic and it's been really tough for them as well as for the patients. I can certainly imagine that the connection of giving time to be able to find out the psychological impact of this, which takes more time to think about with someone, isn't happening as much as patients would like it to be, for sure. Now we're in this position where there are people who are suffering from high levels of psychological distress as a result of their long COVID symptoms. At this point, the question is, how do we support these people? And the support that they feel is best to them, that best suits them, is what needs to be thought about, and how can that be provided? Some of those people will be interested in trying medication. Some people will be interested in talking therapies. Many people will know that talking therapies at the moment have huge waiting lists for anything that's free on the NHS generally, particularly for things that aren't high risk. And that's supply and demand equality that leads to that length of waiting list. And then some people might not be interested in those two things at all. They might be more interested in how can I make my current situation better? Can somebody help me to find ways of not feeling lonely, not feeling isolated? They need specific support for long COVID that includes mental health professionals.
My understanding of counselling is quite often they'll look at what's happened in your life that's brought you to this situation. What's long COVID? It's COVID. That's what's brought us there. And dwelling on that doesn't help because there's nothing we could have done differently. We need to learn to accept where we are. So it's about supporting people in understanding what's going on in their head at the moment, letting go of the past, letting go of the predictions of the future because we don't know, but still being okay with where we are. All of these people are now mentally beating themselves up for not being who they were. That's the bit we need to address, not with medication, but with support. I know my lungs are not working at capacity, but I know that there are things in place to start to look at supporting people with that, which is brilliant. The next thing is the mental support that we need.